So you might have booked your first therapy session or thinking about booking your first session. This can be an anxious time for many people. What's going to happen? How does it work in this first session? So I'd just like to take a few minutes of your time today to explain what happens in a first therapy session. We call the first therapy session an initial assessment. So this can be a scary word for some, as it sounds a bit like a test. I can assure you it's not a test, it's more like a chance for the therapist to hear about your issue and the situation to gain an understanding. So it's a bit like an understanding session. So first session is a chance to understand three main things, and I'm going to talk about those in this couple of minutes that we have together. So the initial assessment is a chance firstly for the therapist to hear all about the problem or the problems that you're struggling with. So we want to know maybe how the problem started, what makes it better, what makes it worse, how long you've had it, what things you might be contributing to it. And for some people, maybe you don't exactly know what the problem is, and that's okay too. You might just be feeling down. So we'll think about that. We'll think about your feeling down. What makes you feel better? What makes you feel worse? How did it start? And we investigate areas around the feeling. So the first thing we're trying to understand in the first session is just all about the problem. The second area we want to understand in the initial session is the wider context. So this means hearing about you, your work, your family, your hobbies, maybe even your early life if you're ready to talk about that. We want to understand what makes you who you are, your sufferings, your hopes, your dreams, your accomplishments. So by understanding who you are, we can gain a picture of how best to help you. For example, somebody might come to me with a fear of losing their job. And it'd be helpful for me to know about previous job losses, maybe previous losses in general. Or maybe in their childhood a parent lost their job and as a result they had to move house, move schools, they lost friends. So it could be that the implications of losing a job in the present day may also trigger a past trauma of hurt from the past, and that's echoing on right now. So as you can see, the full context helps us as therapists understand the meaning of the present problem and the full history of this meaning. The third area for understanding is about the relationship. So this initial session is a chance for you, the client, to have an understanding of what it might be like to work with a therapist. So it's a chance to understand how the therapist might help you, a chance to talk together about the approaches that might be best. Different kinds of approaches. Some focus on education and learning. Some focus on giving you like a blank canvas where you explore where you're at and you don't want to learn anything new. So there's many different approaches that therapists can use, and this initial session allows us, the therapist, and you, the client, to start to understand what this piece of therapy could look like. So my name is Dr. Abigail, and I'm a director of Malvern Hills Private Practice. So if you're still thinking about booking a first session, just please get in touch. We've got a large team of therapists. We work face-to-face in Worcestershire or remotely, nationally and internationally. And it's really simple to get going. Just fill out the referral form online and send it through, and it goes straight for me to read. And I can recommend the most suitable therapies for you. Thank you.